Good morning and happy Thursday. I'm Dr. Dana Hawkinson, Director of Infection Prevention and Control, and we are coming to you live from the Dolph Simons Jr. Family Broadcast Studio. Our guest today is Lauren Lucht, Executive Director of Mental and Behavioral Health here at the health system. She's going to help us better understand why the pandemic is stressing us and offer some advice as to how we can all get through this. First, just about our numbers. In Hays, they have one active and one recovering patient. Here at the health system, we are still doing very well as far as hospitalized patients. We have 6 active infections, 2 of which are in the ICU, but none are on the ventilator. We still have 6 in that recovery period as well, so a total of 12 patients. So I think overall, our hospital capacity is doing well and our overall numbers are good. We try and keep those numbers down as much as possible. So, turning to our guest here, we do understand that the pandemic has left many of us feeling anxiety and depression at some point in the past year, and maybe even coming up as we open up as well. So, there have been infection prevention and control measures that have been the source of some of those feelings. We saw that very early on, and it has continued through. We've also seen adjustments to the mask wearing, and some of it has been better, some of it hasn't. But also maintaining social distancing or just having to separate from people that we normally would be with. And now that the CDC has lifted some of those masking and distancing guidelines for vaccinated people, there are new worries. We did take a poll here at the health system asking 5 questions, and here are those results. Question 1, are you vaccinated? And so we can see here that 86% of our employees did say yes. We still have 5 in that undecided category, and hoping we can move through that, really understand exactly why. And again, as far as the safety and efficacy issues, we can certainly address those because we know how safe these vaccines are. And then, of course, we have a small amount in that partially vaccinated, so just received 1 dose. Question number 2, is everyone in your house vaccinated? And so you can see 55% said yes, 13% said no, and 32% said mixed. You can imagine that there's probably a lot of mixed just because of the children in the household, and still aren't able to vaccinate all the children of all ages at this point in time. So question 3, do you worry about COVID-19 spread without masks? This was probably didn't really know which way this would go. Obviously, 40% said yes, 33% said no, and 27% said somewhat. And it's really unclear if the majority of those people that answered were that 86% that were fully vaccinated, or if they were the unvaccinated populations as well. And question 4, are you still masking in public? Here we can see 38% said always, 22% mostly, 17% said sometimes, and then down there at the end, 10% said never. So there is a good range of those opinions and those practices still there. In question 5, have you resumed pre-pandemic activities without masks and distancing? And we said 50% said somewhat, and between the yes and the no's, it's pretty much the same, just about 25% there. So a good wide range of answers for those last 2 questions for sure. So, all right. Well, so we have a question for you to answer during the next half hour. If you're watching on Facebook, and we'll share the result at the end of the update, answer, are you still masking in public? So now, before we jump to our discussion, are there any reporter questions? Looks like no. All right. Okay.
Awesome. More time for us
so
to
we're
chat.
going. Here we go. So now we have you in studio again, and obviously the first time you came, speaking about a very poignant topic. This continues to be a very poignant topic. And this may seem like a rhetorical question when we're living through the second year of the pandemic now. But what causes anxiety and depression?
I think that's a great question, because I think a lot of us right now as we learn more and more about brain and neurology and chemical imbalances, we've really helped educate the public that, there is a role for genetics in predisposing someone to become anxious or depressed, as well as a neurochemical imbalance. But we know it's a lot more than just that. And so I really wanted to make sure we got an opportunity to say that. I think when patients come in with anxiety and depression, and then a medication that's supposed to fix that neurochemical imbalance fails, then it makes us feel broken, or sometimes why is this not working for me? It works for everyone else. So I really wanted to get a chance to talk about all of the other non-biological causes that go into depression. And those things are really upside down right now in the world. And so people are looking for...
And it's not just chemicals.
It's not just chemicals.
It's what you're saying.
Yeah, it's going to take more than that. That can contribute, that can trigger it, but the solution is someplace else.
Yes. Well, I do know, the pandemic affects people early on, and it continues to affect people now. How is the pandemic impacting anxiety and depression? And I know personally for me, and we were talking before the show started, I have actually had more anxiety now as the mask mandates were lifted. As we are trying to get back into society. Even though individually for me, I know that I'm protected. Again, I've said that, however, if I do get a cough or cold, I have to miss work for 10 days, But overall, being entrenched so deeply in this and having a certain selection bias, I'm just concerned, and I want to make sure that our city stays safe, because I think throughout the whole thing it has stayed safe. But I've actually seen more anxiety now as we've opened up to these new lessened restrictions.
And you're not alone. That is actually really common. There's a large portion of the population that is reporting a lot of anxiety about, even though there's this light at the end of the tunnel, and what is normal? Are we going to get to return to it? It brings with it a lot of, okay, but this stuff kept me safe, and I need to carry it with me. And there's a lot of evidence to show that is still really a helpful thing to do. Yeah. So I think that leads right into sometimes anxiety and depression is your brain trying to tell you something. And so, if your brain is saying, I feel more comfortable in a mask, by all means, we would want people to do that. Now, paradoxically, patients who came into the pandemic with pre-existing levels of anxiety and depression are actually reporting that their anxiety and depression got a little bit better during the pandemic. And that is really fascinating.
Yeah, and I would say too, as we move further into this, and it becomes just a little bit more normal than it was, say, a few weeks ago, such as masking. I'm one of the few holdouts to wear my mask in the gym still, but that has decreased. And I think as we get and it becomes more socially normal, it will be a lot easier. And I think as we get into this, maybe any other simple practical tips right now that we can do to help with that and get us through that?
Absolutely. So I think we learned a lot about the people who became more anxious and depressed during the pandemic versus those who had it before the pandemic and saw it lessen. And when we look at all the things that go into it, it looks like it's a matter of perspective. So if I am really anxious and depressed as my baseline pre-pandemic, and then all of a sudden the world is also feeling a level of anxiety and depression, I'm not alone. And on the news, I'm watching us band together. We are going to beat this invisible virus. And that's a good feeling. And we know that feeling of connectedness and belonging really drive down symptoms of anxiety and depression. And so for a lot of patients, that improved their connectedness. They're seeing people, outside of buildings in New York banging on pots and pans. And that's just such a feeling of, we're going to beat this. We can win. This is love, and we can do this. On the flip side, people who didn't already have significant levels of anxiety and depression, this turned worlds upside down. This took the social support system that you had away. This changed parenting. This changed extended family relationships, and all of those things that maybe were traditional coping mechanisms were somewhat taken away from us or made harder to achieve. And so what we'd say is, remember that perspective. Continue to focus on what provides you meaning and purpose in your life, and take that no matter what is happening in the world around you, whether it's a global pandemic or whatever our next obstacle may be in life. But remember that perspective. One of the most common comments we heard from patients reporting decreases in anxiety and depression is when they saw how many people were dying and how much worse it could be, they felt a sense of gratitude that they'd not had before by being safe. And if the mask helped them achieve that, you could see why then getting rid of that may be really difficult to sort of let go of.
Yeah, no, I can totally understand that. We've talked on the show several times about how I think we are very fortunate in our community that we haven't seen the same problems as some other cities around the United States. So thank you for that. Now, Jill, any questions from the community?
Yeah, we're starting to get a few. So Joni says, are children safe to resume summer activities? The pandemic is still with us. Is it safe to be at summer fairs, 4th of July picnics, and softball and such?
Yeah, I mean, again, with lowered restrictions, masking restrictions, that is separate than is it fully safe. We do understand there continues to be risk out there. We know that overall the number of hospitalizations have decreased around the nation. We know that the number of cases have decreased. But if you're doing things, it's all about understanding what the risk is. So we do know children can still get the disease. We know that they can have, although less prone to those very severe outcomes, they can still get it, and they can still spread the disease. But if you're doing things like outdoor activities, such as camps, if you're most of the time outdoors, or fairs, as you mentioned, I think that's a lot safer. And you just have to understand and judge your risk. If you can have everybody else in your household vaccinated that is vaccinated, that is going to be much better as well and add one more layer of protection to you and your family.
Craig asked, I get depressed when I realize I have very different values and beliefs in science than many of my family members and friends. That has been one of the most frustrating, stressful things to me during the pandemic. And I got to tell Craig, for the first time yesterday, I had a person call me that was wanting to actually meet you, Lauren Luck. It's a vendor. And they, I just was asking some routine things, and they are not vaccinated, didn't feel the need, didn't understand it, didn't believe that, it's the first person that I have encountered in the whole pandemic that was just that strong in their beliefs. Never get sick, don't take a flu shot, don't, what do you say to Craig and even me right now?
Well, that's a tough one because there are people who have really strong beliefs about this, and your friend or acquaintance is absolutely not the only one. And what I'd encourage people to do is try to separate science from their belief system as much as possible, because we learn and shape our beliefs over a really long period of time. Luckily, science is moving at a slightly faster pace, and so we learned about this pandemic. And I also have some relatives that were anti-vaccine or anti-mask, and I validate that. It is really hard to support that portion of your life, and those people. You can't force your beliefs on them, but I would encourage people to just continue to educate and remind people some perspectives. But again, I don't think we're going to force people. People have to want to do it. So it's how do we shape those beliefs slowly over time to have some faith in science. I think it was really compelling. As soon as I saw that Dana was going to have his kiddos vaccinated, I signed my kiddos up. It's just sort of I'm going to follow the science, and that's what I've chosen to do. But my belief and my studies have been sort of in science, and so I'm an easier converter.
Yeah. I think that's important to understand, too, is just as you said, separating your belief from the truth or the reality. And your beliefs may not be informed by that truth or reality. What are the information sources you're getting that to help form your beliefs? Or have you even done the research, or is it just what you believe, but you don't have any specific reason as to why? And I think it's just continuing to talk try to understand why, but just continuing to give that message because we do know that there are sources of untruth out there and a lot of misinformation campaigns out there. So it is important to find those sources of, truth. What are those real sources of truth? For the most part, people, it can start with their physicians, but it can start on the web with the CDC and the FDA websites and those trusted, respected medical and science websites or sources. The other issue is that's okay if you don't believe that. Just be consistent in your thinking, because I bet it's those same people that if they have cancer or if they have a sinus infection, they're going to want to get antibiotics. So, but that's not consistent with saying, well, I don't want the vaccine for this. So just be consistent in your thoughts. And I think it's just a matter of trying to continue to understand exactly why and how and where those beliefs come from, and just address it and keep giving that message of the science and the medicine and the care for other people.
Isaac is asking about suicide. And during the pandemic, if you had more people, do we see a spike in patients with injuries related to suicide attempts, drug overdose? How severe was some of the reaction, and what did you experience?
I have not yet seen data at a national level on attempts. We do know that the suicide rate did decrease in 2020, which is a little counterintuitive. What we do know is that number may be convoluted by several factors. It was not a full percent that it dropped, but we also know a lot of people died of COVID-19. We know people died at a higher rate of drug overdoses. So the data is still yet to be collected to confirm it and to try to understand and learn and inform our decisions on what impact the pandemic really did have on suicidal behavior. I have not seen an increase in more serious attempts, suicide attempts, here at our organization. But it's important for the world to understand and for Kansans to understand that we do see serious suicide attempts every single day, and it is still very much a problem in our country, and something that we really want to make sure that people are starting to get comfortable having dialogue about and talking about thoughts of suicide and how to cope with those. It's not a completely abnormal thing, and people are not alone who have those. It's actually really very common.
Well, and that messaging may be a little bit confusing to people when we've had our guests on from Marillac who said that among that population, the demand for services has gone up really high. So can you kind of reconcile those two things?
Yes, let me do that, and that's really helpful. So at Marillac, we have a specialty unit that is called the Insights Program, which is designed for adolescents and pre-adolescents with suicidality. That is the entire focus of that unit. We have had an increased
What does
demand.
ideality mean?
Suicidal thoughts with some desire to act on them. So if we do just look at the child population, we did see an increase in demand for those services. What we don't know yet is are we getting better at identifying those children and getting them connected with the services they need, or did we truly see an increase? I suspect we did see an increase in the child and adolescent population. Their lives were turned upside down even more than the adults. I mean, school has been a consistent thing in our country for many years. You start in kindergarten, you go through 12th grade. Throwing this wrench into, the two distinct school years and still uncertainty about what next school year will bring, I think that absolutely impacted our children and adolescents more than we initially thought that it would. But in the adult world, we did see a slight drop. So that maybe we are learning things during this pandemic about how to cope, and also we're realizing that we're really not alone. It is really common to have anxiety, to have depression, and to every once in a while think about if you have the energy to keep on going. But it's really important we remember those are temporary problems, and suicide is a permanent solution. So work with us and let's find some real solutions that give you your quality of life back.
I've also ran into a lot of people. In fact, one of them was the lady who cut my hair. I finally, yes, after a year, went and got my hair cut. And the woman was telling me, she goes, I just want to let you know, she said, I'm opting to not work anymore. She said, The pandemic has allowed me to spend a lot of time with my family. We're reprioritizing, and I'm going to be staying at home or trying something that I can do from home. Are you seeing a lot of that?
We are. I think that, like we said, so many aspects of our lives were turned upside down, and that's one of the helpful things is it gave people a new perspective, a new opportunity to look at what really counts. And some people looked at, okay, the 80 hours I'm working a week that I'm not with my family, now that I've been working remotely and I'm seeing all that I'm missing right in front of me happening outside of my office doors, I'm reevaluating what makes sense to me. And that ties right back into that person is then less likely to experience depression and anxiety because they found a real meaning and purpose for what they want to be doing with their life. I sort of conceptualize that the difference between a job and a career. If you feel like you have passion and purpose and meaning in what you do, you are less likely to experience anxiety and depression.
All right, Jonna writes, I'm told that I should exercise, sleep right, sleep more, eat right, but all that is hard to do when I'm sad and worried. How do you get started?
That is such a great question. I, as a mental health professional, I also struggle with that because I can say self-care and carve this time out and be good to yourself. And those are very easy things to say. They're very difficult things to actually do. So what I like for people to focus on first is figuring out that perspective, that framework in which you're going to view what's happening in your life. That does not have to be a therapy appointment. It can be. But a lot of people are able to do that on their own just by journaling. So 5 minutes of getting those thoughts out, kind of working on your conceptualization of where you're at in your life, what you want to change, what you want to keep and continue to grow and be good and fruitful. You can do that on your own, and then definitely reach out to a support system and build a support system. There's phenomenal groups now that are supporting each other in ways we would not have had the creativity to imagine before the pandemic. So leverage that.
And I'm curious, and then I'm going to ask Sharon's question, but how does your brain ever flip? Because when I look at Dr. Hawkinson, I know that he has the feeling of, I have to go and exercise. He looks forward to it. It's something he wants to do. It's part of his routine. We're doing this wellness challenge here at work where we're walking, and now that has become like, oh my gosh, I've got this other box I've got to check before the end of the day. When does the switch flip and I become like Dr. Hawkinson and want to work out every day?
Well, I also am waiting for the moment where my body says I want to go exercise, because that's not happened to me either. But it's not it doesn't have to be exercise for everyone. So find what works for you. And maybe it's after a couple of weeks of journaling, you kind of come to an understanding of yourself about really what it would be about exercise that you think would add value or health to your life, and find some sort of compromise. I hate running and I hate sweating, and I now have just admitted that to the world. But I can do Pilates and yoga primarily because I get to do it laying down. So, I mean, there's ways to be healthy and exercise and get our heart rates up without it being quite as brutal as we imagine. A 45-minute run on a treadmill sounds terrible, but find what works for you. Walking around the block is also incredibly healthy.
When have you always been that way? Just can't wait to get to the gym? Because I remember when the pandemic started, you were...
I mean, I've just always been physically active. So for one reason or another, sports or...
Yeah. So Sharon wants to know, what should we say to home health care workers that have not been vaccinated? My 97-year-old mother is fully vaccinated, but the caregivers are not. They both wear masks, but she has anxiety around this. So what would you say, and how do you deal with the anxiety?
I think that's a very real problem. Obviously, we saw 80% of our healthcare workers are vaccinated. We know that continues to be a significant issue in the nursing facilities, although the infection rates and death rates have dropped significantly since the beginning of the pandemic and since vaccination. We know this continues to be a very common and significant problem for healthcare workers, especially those in home health as well as nursing facility health. We are still trying to work on how and why, and I think it's part of that, continue the messaging, continue to talk to them and encourage them. Because we do know also that a lot of those healthcare workers and a lot of those workers in the nursing facilities do come from some increased risk communities where there are a lot of people living together, multi-generational housing, lower socioeconomic communities. So it is vitally important for all healthcare workers, for everybody, but especially for those groups of healthcare workers, whether it's in-home or nursing facility or health system healthcare workers, to continue to get vaccinated.
I would say, remember, not all anxiety or depression is irrational. I too would have a great deal of anxiety with a home health worker taking care of one of my elderly relatives without being vaccinated. And so that may also just be a signal from your brain that something is wrong, and you want to call and see if there isn't a vaccinated home health employee that could be assigned to provide that care.
Yeah. That's good advice.
Catherine says general advice for anxiety has been control what you can and let go of what you can't. But how do you do that in this pandemic environment coupled with extreme political polarization? I mean, that's the
an
elephant in the
insightful
room.
question,
So
yeah.
there you go.
Is, yes, and that is a great way of sort of saying all of this is adding on top of each other. It is all,
Yeah.
and when it comes together, it feels overwhelming. And so we don't do well when we're overwhelmed and trying to solve huge problems. I mean, structurally, our bodies weren't designed for that. We have fight or flight. And fight or flight is not a good time to sit down and contemplate how you're going to feel about something. So I would really, the journaling could be something that would be really helpful to sort of try to separate those things out. And then in your own mind, how do I understand how they're adding on top of each other? And what's one little thing I can do to lower my stress level around each of those things? Don't try to attack it as one big problem, because it's not. I mean, they all do at some point intersect and affect all of us, but they're actually coming from a variety of different causes. And so we won't solve them with one solution, and definitely not one pill. So try to make a list and come up with what little things can you do to try to take just enough of that off that it becomes manageable again.
Okay, Karen says, what about mass shaming? It feels like everyone is judging me and assuming I've not been vaccinated, but I am. I feel self-conscious.
I love that question. I keep getting to the gas station door and then realizing that I don't have my mask on, and I'm running back, and then people are like, you don't need your mask anymore. I'm like, no, I feel like I need it, and I'm also completely vaccinated. It's just, people think about you way less than you think they do. And I think that's a really good thing to remember.
That is a good thing.
Most people probably don't care at this point. I mean, you're wearing a mask. You're doing what you need to protect them and to protect yourself. Who cares what they think about you, and if they think that your mask is a sign that you're not vaccinated? I'd be proud and share that I'm vaccinated and not worry about someone who's judging me. That's probably their problem, not the person who wrote in.
And I just say a large proportion of the people that aren't wearing masks probably are not vaccinated as well.
Right. Maybe more.
Yeah.
Because they may have been our anti-maskers and anti-vaccine patients from the beginning.
Cindy wanted to know, are the people hospitalized in the ICU here, are they vaccinated?
Yeah, I was writing to Amanda, who will be on the show tomorrow, and we should have some demographics tomorrow for that.
Okay, and Sam was asking, are the symptoms the same for people who are coming in for the pandemic? Are they as severe? Because it seems like that the ones that are being hospitalized, are the symptoms the same? Are they severe? We just don't talk about symptoms anymore. And
Well, I would imagine that if you're coming to the hospital, you're really going to have that same disease process as people who were admitted to the hospital, a year ago or 6 months ago, who are unvaccinated. I think if you're coming to the hospital, a lot of those symptoms, if you're coming for COVID-19, a lot of those symptoms are going to be the same. Shortness of breath, malaise or just feeling bad, fever, cough, maybe some chest pain or discomfort. So I think that if you're coming to the hospital for COVID-19, your symptomatology, your symptoms that you have, and the intensity of those symptoms is probably going to be the same as it was prior during the earlier parts of the pandemic.
I wonder if part of that question was, are people now aware that because it can be so lethal that they are coming in earlier and maybe less likely to require being on a vent?
That's possible as well. So I think probably the wide range of all
It's
that.
everything
But I would
combined.
think that if you're coming to the hospital, a lot of those are going to be the same kinds of symptoms, yeah.
Makes sense.
Yeah.
And then we have time for one more question today. Becca says, are we testing enough, and are we still contact tracing? She's wondering if those efforts are still going on.
So I'll address that as a global question, meaning in our, not just our health system, but are we testing up? I think we do understand that around the United States in our community, testing is probably down for one reason or another, and we've tried to address this, whether we're just weary with it, whether you are vaccinated or unvaccinated, you have some symptoms, and you're just not wanting to get tested at this point. So I think overall we believe testing is down. And then contact tracing, yeah, there is still contact tracing going on through the health departments. They are still looking at those. Should that need arise again for, suspected super spreader events or things of that nature. But as far as I'm aware, through KDHE and the local health departments, contact tracing still is going on. Yep.
All right.
All right. More questions? All right. Well, tomorrow is Friday. It was a nice short week with the holiday. And the Royals are at home with 100% of fans in the stands. The weather will be 87 and sunny. And it's a perfect forecast to look toward the weekend and answer your questions from there. It's also a perfect time to have an incentive to get vaccinated or tested. We have details of a fun incentive happening at the Speedway tomorrow and Saturday. Plus, we will have Amanda Cackler, Director of Quality and Safety, in studio to answer the questions, so you can start by sending your questions now. So before we go to final thoughts, Jill, do we have our poll results?
We do, and the question that we asked people were, are you still masking in public? And right now, so far, 50% said yes, 10% said no, and somewhat said 40%.
Yeah.
So people
Okay.
Still
And
masking.
I would imagine, just with our selection bias of our population that is watching or listening, they are probably mostly all vaccinated as well. So, all right. Well, thank you. And any final thoughts?
No, do that journaling. Figure out what's
Yeah.
bothering you. It's not always just a pill as a solution. So don't stop taking any antidepressants or anti-anxiety medication. Talk with your doctor about that, but make sure you're not just relying on the pill. There's a lot of work to do outside of that, and so we've got to help each other along with that.
That's right. And anxiety can occur early on, and if we saw it can occur later now with these changes. Just remember that if you are having those problems, please seek help. We have, access for you here at the health system. Seek help for those issues. Get well, stay well, and we'll look forward to seeing you tomorrow.